Today, we're recommitting to our bold goal that by 2014, no patient will have to wait longer than 3 months for surgery. And part of our plan to achieve it, of course, is what I've just indicated. And I think it's worth a question for the media to ask Mr. Lingenfelter and the NDP if they are going to change the surgical wait times initiative. If they're going to go away from a plan that's working and go back to an ideological past where people simply waited 18 months, 15 months, 12 months for surgery that relieved their pain. We've made great progress on recruiting and retaining professionals, on increasing training seats, on finding efficiencies within the system, and on building on healthcare infrastructure, and on reducing wait times, but we readily admit that there is more work to be done. And so today, we're announcing the Saskatchewan Party's 5-point plan to improve access to healthcare services. The plan focuses largely on rural Saskatchewan, where we know that concerns about access to doctors and treatment and emergency care is most acute. The Saskatchewan Party government's 5-point plan includes 1, forgiving up to $120,000 of student loans for new physicians and up to $20,000 of student loans for new nurses and nurse practitioners who practiced in underserved rural and remote communities of our province. We also want to point out that this is not just for new graduates. If there are doctors who are practicing in urban centers who would like to take advantage of this, they can also receive this student loan relief if they'll move to a rural community or an underserved community. The initiative is targeted specifically for communities that are experiencing difficulty attracting healthcare professionals or experiencing chronic vacancies. The initiative will complement the loan forgiveness program announced by the federal government in their election campaign, which forgives up to $40,000 for doctors, $20,000 for nurses and nurse practitioners. The full amount will be available to new doctors, nurses, and nurse practitioners who work in a community of about 10,000 people or less for a period of 5 years. They need to stay there to earn the benefit for at least 5 years. Number 2, we will work to expand the scope of practice for nurse practitioners. We think there's a bigger role for nurse practitioners in the rural system right around the province, and we know that the opposition believes the same thing. But what I think might have been missing from their plan is the fact that we actually need more nurse practitioners. We need to fund training seats. And much as the Minister of Health has led the effort to train more nurses in the province, we'll commit today to expand the nurse practitioner training seats in the province from 30 to 50. Number 3, we'll create a 20-doctor rural locum pool. 20 doctors in a rural locum pool that are meant to provide relief, especially to rural physicians, to maintain doctor services within smaller communities. The pool of doctors will serve as an incentive for them to set up a practice in rural Saskatchewan because they know they'll have the support and the relief they need when they'd frankly like a break. We will expand the EMT pilot project currently underway in East End, Saskatchewan, to better utilize the skills and training of emergency medical technicians and other mobile health service personnel. In East End, those EMTs are providing round-the-clock service and are engaged in home care where it's needed in that community. We think that pilot project bears some investigation for the rest of the province. And finally, we will fulfill our commitment to bring STARS, air ambulance service, to the province of Saskatchewan, providing top-notch emergency coverage to complement the great road ambulance services we have in Saskatchewan.